And good evening and welcome to September Health and Education Committee meeting. And first order of business, of course, is to approve the minutes, and I need a motion to approve, please. Commissioner Shanto, thank you very much. A second?
Second.
Second, Mr. Turner, thank you. All in favor of approving the minutes? If there's no discussion, please say aye. Aye. Okay, first order of business, community care report. And we'll have one other quick comment about the community care facility here in just a second. It is on your electronics there, community care, and you've had a few minutes to look that over. And the mayor is here. He's chairman of the committee, and Ms. Cook has been on the committee for how many years, Ms. Cook? We don't want to talk about how many years.
I don't know.
Okay, more than a month. let's go with that. Anything to report, Ms. Cook?
Everything's going real well out there.
How about the construction? Are they still?
Still needing some OKs unless they got it since I was out there.
They're likely in there since we had our last meeting on September 5th. They were all but ready to
Yeah, they was just
open.
waiting
It was
Wait.
like it was finished.
for the state to approve some things. So it should be ready. I hope so anyway.
Haven't been out there in a while. It's worth the visit. It's really a beautiful facility and in a beautiful location. Of course, as most of you know, Mr. Mayor. Anything on the financials there? We're in good shape.
They're doing excellent. Good receivables are good, cash flow is good, and they have substantial reserves.
We have a compliance officer that's doing a real good job keeping the complaints down. And he's taking hold of them firsthand.
Okay, I need a motion to approve the report, please.
So
Ms. Cook, and a second from Commissioner Jordan. Thank you. Any further discussion, comments? If not, all in favor, please say aye. Aye. And opposed, and of course, there is none. Now, let's just a mention here, and Ms. Cook may help us out here just a little bit. We have been invited, as we usually are, at some point during the year. I don't know if Ms. Cook and I even really discussed this at any length, but anyway, they would like for us to come out again and have a meeting out there. And I think we're probably going to Stewart's Creek. I haven't done anything on that yet, but if we don't meet in December, that puts us maybe in the spring, out of winter and March and after the time change. And but I just kind of wanted to, well, we can discuss that at a later time, but probably not this fall, unless you all want to do that. Otherwise, we'll just wait till spring. They'd like for us to see the new construction as well. And correct, Ms. Cook? Do you have any? Am I saying this right?
If you want to come out in December, you can see the Christmas trees that we auction off. and that you're able to buy and take home with you for your Christmas. And they're unusual. They're a lot of fun.
A salesperson on the roof here.
Sure enough.
Okay, I don't think that calls for any action. Ms. Garrett, come forward if you would, please, and welcome. Health Department report, number 3 on your agenda, and also on your iPad, I believe.
Yes, should be on there. Okay, so first just the report, the routine report that I give to you guys every month. And we talked about last month how we had some medical issues hit several of our providers. And that's still reflecting in this August that we should be back to capacity in September. So that's good news. But this is August's report. And we still had quite a few providers out with medical family leave issues. Of course, in August, we always see an increase in vaccinations. I guess we can all figure out why, right? The back-to-school rush. So that's normal.
I know we mention this every month with
Yeah.
flu shots. Are you all already underway with
Yes,
that?
yes. I was going to talk about flu shots. So
Sorry.
No, I can do this. No problem. So we are, we're in the process of getting our flu vaccine quantities in. We're going to start October 1st, offering it. No appointments are needed at both of our sites in Smyrna and in Murfreesboro. 8 to 10, 1 to 3 is probably a good time to come, but we'll pretty much do it all day whenever, for no appointment needed, and they can come in and get the flu vaccine. It's also available readily around the county. There's no shortage or any problem getting it this year. Lots of their private doctors will have it, and pharmacies and grocery stores and work sites are having companies come in and give it. So there's a great need for it, and there's a big supply, so there's no problem there. At the health department, the vaccine is $30, and it does slide according to their income. So if someone can't afford that, the computer figures out based on their family size and their income what is a fair rate to charge them, and it does slide. So that's something to have available. We also file Medicare, like we always do every year, and TennCare as well. If they have private insurance, we'll give them a receipt that they can file to their company and get it back if they'd like. Any other questions or something I might be forgetting about flu to tell people? Oh, another thing is we usually offer the off-sites at the senior citizen centers in both Laverne, Smyrna, and Murfreesboro. Laverne and Smyrna had very low participation the last 2 or 3 years. I think just because it's so much everywhere that they just said, "No, we won't ask you to come out this year unless something comes up later. They'll call us." So we don't have anything scheduled with them yet. The one in Murfreesboro, St. Clair, did ask us to go ahead and schedule because they still get a pretty good turnout at theirs. So October 28th from 8 to 11, and you just call St. Clair's Center to set up an appointment. We'll be doing flu shots there if anybody feels more comfortable going there, or they'll be there for other services. They can get it then. St. Clair's phone number is 848-2550, 848-2550, or the Murfreesboro or Smyrna Health Department. Murfreesboro's number is 898-7880, 898-7880, and Smyrna is 355-6175, 355-6175. You can call for more information, or if you have a specific question about your needs, we can answer about flu.
October 28th, right? October 28th.
Yes,
of
at
St.
this
Clair.
at St. Clair's, October 28th, 8 to 11.
Anything else on the report, Ms. Garrett? Any further questions? Commissioner Phillips, thank you for the motion. A second?
Second.
Mr. Shanto, thank you. Any discussion? If not, all in favor, please say aye.
Aye.
And there is no opposition. Ms. Garrett, you have something else?
Yeah, I just wanted to update you guys about a couple of things. One is recently the General Assembly and the governor have decided to take some of the tobacco settlement dollars that the state receives every year and reinvest that into health programs to help fight tobacco abuse and tobacco use. So they are going to be giving us an endowment grant for the health department. It'll be a 3-year grant, and so I'm really excited about that. The exact amount is still to be determined, but somewhere around our county, they did a formula based on need, how many people smoke in the county, which in comparison to other counties in Tennessee, we have a lower number, but not in comparison to other states. Our number is pretty high. And then they also looked at population size when doing the formula of how, and of course, so that gets us quite a bigger chunk because we have such a large population. So we'll probably end up getting about $100,000 or so to work on 3 things that they want us to work on. Pregnancy smoking, which in Rutherford County, it's 12.2% of women who are pregnant smoke throughout their whole pregnancy, causing low birth weight, lots of complications for the babies, more risk for asthma and allergies and those kinds of things. So we really, really want to do a targeted effort. And the health department's going to partner with, many community partners to kind of pull this off through our wellness council and different things that we have. So I'm excited. It'll either be, we have the 3 topics, and they want us to do 1 topic each year, kind of focused effort. So the pregnancy smoking, secondhand smoke. So just reminding and teaching parents that, smoking in the house and smoking in the car and those kinds of things, and how dangerous that is for the children that are in the car. And then also prevention at the middle school level. So we'll start some programs trying to focus effort on preventing children from ever starting, and, you know, maybe targeting sporting events and those kinds of things. So we'll be coming up with a plan. But I'm excited that our community's getting that funding and that we can target and focus on those efforts. So I just wanted, y'all will hear more about it as we get the money and that, but I just found out some of the details of it the last 2 days I've been in training, so learning about it.
I'm
Yes,
just
sir.
going to ask about when you think the money is coming in.
They're saying December
Okay.
of this year.
So I just wondered when we should start the process of being able to allow you to accept the money and.
Right,
and
exactly.
Start the process.
It's non-magic.
Right, exactly. They're calling it an endowment grant. So it's not even like reimbursable funds that you have to send in and get reimbursed or anything. It's just going to come to the county for us as the health department to spend according to the guidelines and to meet these. You know, one of the things for us to get the continued year 2, year 3 money is to show, you know, outcomes, good outcomes, that these programs have been successful and have made a difference and a change. So that's the 2-day training I've been in, is learning, you know, what kind of plans are evidence-based and what are good plans to use in the community. And then we'll go back and talk to all our community partners and see how we can stretch that to even go further. You know, if we get coordinated school health in, then we can stretch our message with all of their reach. And, you know, if we get the hospital in, then we can stretch our message with all of their staff. You know, so it's just a way to pull everybody together. But instead of, this time it actually has some funds attached to what we normally are trying to do. So I'll be excited to see what we can do. As soon as I find out, you know, officially the amount and when we'll get it and all that, I will bring it to you guys to advance forward. But probably very soon we'll be hearing more.
Do they decide what order we do those 3 in, or?
No, that's for us to decide in the community. So we have partnered in the past with MTSU on a great program called Smart Moms. And Smart Moms is just a targeted 5-minute message that healthcare providers are taught to talk to the pregnant women about smoking. And it's through the March of Dimes. It was originally done through the March of Dimes. It's had huge success. We've done it before. And I like to believe that's why we have such a low number, which is 12.2%. Some counties that I was sitting in this room with, they have 39% and 34% and 24%, you know, so we are lucky in that our number is lower due to some education programs that we've put in place in the past. So we're thinking we could easily start back doing that Smart Moms and targeting our message to all OBGYNs if they're given that 5 and 10 minute special lesson to their prenatals, then maybe that would help cut that number even more. That was just something exciting that I wanted to share with you guys.
Comments or questions?
Well, maybe one.
Yes, sir.
Yes, sir.
Kind of triggered a thought. Recently had a physical, and we were talking about preventive care just now, but do we offer through the health department such vaccines for when you get a little older, at a certain age, and you probably tell I'm there, Jeff.
I wasn't going to say a word,
For
Commissioner.
shingles and pneumonia and something called CD, that kind of thing, those type of shots. Do we offer those through the health department?
We do on a limited amount. The majority of the vaccine that we offer is vaccine for children
Okay.
and at the health department. But we do have some on a limited amount based on income and certain guidelines that people meet. But yes, that is a targeted effort. That the tetanus with pertussis is very important because we're seeing a lot of babies that come down with pertussis before they're fully vaccinated, and they think that could trace back to caregivers like grandparents and parents who maybe aren't vaccinated against that. So that is an important one to check with your private doc about. And if you don't have it, you can call the health department. We'll give you some resources if we can't offer it. But yeah, that's a good question. We were just talking about that actually maybe before you got in here, before we started. So it's a good question.
Have we made good progress with the new dentist? You said that there was one that was going on. Is
Yes, she
everything going smoothly there?
started seeing patients in September. Yeah,
Yeah, what month it was.
Yeah, I had to think what month. In September, and it's been really great. We've already got our school transport program back, where the kids are being transported over that are really have some dental problems going on. So she's already started that. We're doing the WIC while people are there for their WIC visit and they're waiting for maybe their vouchers or something. She sees the baby and gives some education, and then of course our regular patients and that. So we're so excited to have that.
Good. Do we ever do
Yeah.
a targeted announcement for that, or is it just one of those things that they find out as they come in, or is there? I'm just wondering if there's people in the community that don't know we have a dentist now
Well,
that's available.
we worked through telling some of our major partners, like the Wellness Council, who's a lot of the health care providers in the community and the
Yeah.
hospital. But no, we didn't do like a press release message or anything, but talking about it here.
I just want
and
to make
just
sure people know
with
that
our-
that
exactly.
service is now, available again if they need
Right.
it. That's why it's there.
And with the
so.
patients that are in our building every
Sure.
day, we see about between the two sites, 250 patients a day, so just getting the word to them that way
Yeah,
too.
that's good.
Exactly.
Anything else? Thank you, Ms. Garrett.
Thank you.
Appreciate your report very much. Ms. Jolly? Special Projects Report. Good evening, Ms. Jolly. Take it away. Not a lot to report, is
No,
it?
there's not. If you have any questions, there's really not a lot to report.
Is it any different than last?
No, just a few more, bills have been paid.
I couldn't tell one thing.
I know it was mentioned that bids were accepted for the Smyrna Primary Edition. We've got to vote on that yet. I expected to see that on this month's agenda, but we don't have it. Do we have any idea when that's coming forward? 'Cause I know they told us last month, I think they'd opened bids a day or
Right.
two before, and it's got to make it from here to budget to the commission, or, some facsimile thereof.
Mhm.
But I guess, you're just the messenger, and, but
Okay, committee, we've had the school building program status report for a week or so. Some of us have. Oh, man. Actually, I get the report. I just can't print it, so I have to read it on my computer. I don't know what the problem is.
Move to approve the report.
Thank you, Commissioner Phillips. A second to approve?
Second.
Commissioner Turner, thank you. Any discussion or questions? If not, all in favor, please say aye.
Aye.
And opposed? None? And thank you, Ms. Jolly.
Thanks, Teresa.
Okay, committee, a teensy bit embarrassed. The school board, as I understand, Mr. Odom was coming tonight. I don't know if he was going to present the Smyrna primary or anything else to us tonight, but he said it would be a information sharing session. And then I got the information yesterday, so it was too late to do anything about it, that they would not be able to be with us tonight, and that they had no amendments and no official business for us to vote on. So we can look forward to it. And he said, we look forward to October. That was Mr. Savig's closing email. So with that in mind, we can go to number 6, discussion of future meeting dates. And as I think I told you the night we had a very brief committee meeting at the commission, that I had asked for October 29th per your instruction to be our next meeting in October, and that Ms. Taylor had done that for us. And I guess we need to just say that October 29th will be our next meeting, unless there's some comment or from anyone. That gets it, if you recall, a couple of weeks past the commission meeting, rather than just 4 or 5 days past the commission meeting.
It's actually kind of our normal meeting.
Right, exactly right. Just kind of an unusual way it falls in October. So we will, I'm circling October 29th unless somebody says something quick.
This fifth Tuesday.
It is that month. That is correct. And I will notify Ms. Taylor that we have selected that date. It is still available, as you can see on your agenda, which takes us to November. And Mr. Phillips has his trusty calendar there. And what is our regular Tuesday? It's Thanksgiving week, isn't it? And
Yes, it is. It's the 26th, I believe.
well, I don't know what you all want to do. It really doesn't make any difference to me. I think I'm available on every date that she put down here. I think we can generally agree, however, that that particular date is probably not a good date. Schools are out the next day. It's Thanksgiving week, etc. But I stand to do with the committee's wishes, as always.
Participation would be down.
I would think so.
That week. I'm not sure we'd have a lot to do. I'd be willing to bet that the department heads would appreciate moving it.
I think we could probably count on that. Well,
If we moved it, Jeff,
Mhm.
like to either I think you've got the 4th on there, or maybe even the next week, could we possibly, Ms. Cook mentioned the possibility of going to community care to see what some of the citizens that are participating in that care could we possibly move the meeting date out there?
that would be,
And then it wouldn't matter. We wouldn't
what day do
conflict.
you, talking about any day?
Yeah, any day.
Well, we don't usually have a December meeting.
That's correct.
So if we push this one back to December 4th, that could kind of be a
It-
hybrid almost.
It really
Give-
could, Jeff,
give the
or
school system more time to get much stuff together and not have a chance of having something come up that,
Big lapse.
or
Yeah,
even that
bigger
following
plans.
week, like the 10th or something like that, it would even push it back a little further.
Do you have any other dates other than November 20th, 21st, and 4th?
Any of
The
those
only
will work.
problem is if you might need something go to budget committee. If you go to this week, the 10th, you've got the commission and you've got no time to send anything to the budget committee.
do the
4th, the
4th.
night before budget, so
Let's do it the 4th, if that's okay, sorry.
we've already got that penciled in my
December
calendar.
4th.
Apparently, that's what we said last month.
I had that as one of the potentials, it looked pretty good now.
Okay, is that 4th is okay, and you like me to call Mr. King, or Ms. Cook can, or the mayor can, and see if we can go out there?
Correct.
Is that the wishes of the committee?
Okay with everybody?
Fine with me.
I really like being out there. I haven't been out there in a while, and I like being out there. And if Carol says, Ms. Cook says that they're going to decorate the place, and I think they kind of like showing it off.
You do.
I kind of like seeing it.
You have plenty of snacks.
All right.
No clerk.
That's right.
So 5:30,
Eggnog and
5:30.
Okay, first of all, we'll agree that November 4th is the date that we'll meet. December 4th, excuse me. And Ms. Cook, you and I will just get with Mr. King, or I'll ask, you'll be seeing him since we have a month. You'll be in a meeting out there, I'm sure.
The next day's meeting. Us too.
But, whatever, I can call him if you wish.
Yeah.
And so I'll let you know in November if the date's okay. We'll do the date and here if we have to, and then if not, then if we can go out there, then that's a great idea. Thank you, Commissioner Phillips. I don't think that calls for any vote. Any new business? Anything? Don't see anybody. Don't hear anything. We are adjourned. Thank you so much, committee.